Welcome to the Ways and Means Committee hearing for the second session of the 117th Congress and the committee's first hearing on mental health in more than a decade. For far too long, Americans have shied away from conversations about mental health, contributing to the deeply held stigma about seeking care. While we've made great strides in recognizing the importance of caring for our mental health as a society, it's appropriate for Congress to act. Before the pandemic, 1 in 10 American adults reported symptoms of anxiety or a depressive disorder. Since then, that rate has skyrocketed to 4 in 10 adults. There's no denying the pandemic has exacerbated the mental health crisis, and we will hear today of its effects. On top of life's typical triggers, people are now in the position of having the fear of contracting COVID-19, which means prolonged social isolation, the stress of uncertain or unpredictable childcare, and the anxiety of losing a job and economic security. For health and human service workers and other essential workers, this trauma has permeated their entire lives as they deal with the effects of the pandemic at home and at work. The added stress of being overworked or short-staffed is pushing many Americans to their limits. This provides a crisis on top of already a crisis. And the impacts are not only felt in our personal daily lives, but also in our economy. For those seeking care and taking care of loved ones, lost earnings due to serious mental illness represent an estimated $193 billion each year. On top of this, we hear far too often about the difficulty constituents face in accessing services to address their mental health needs. From being forced to wait months for an appointment to the challenge of finding in-network providers, the current state of our mental health care system is unacceptable. The workforce hasn't been able to keep up with demand, and insurance plans haven't expanded enough to include this crucial care, despite long-standing requirements and the really good work that Congress has done in the past. There's no single solution to strengthen the system, but a good starting point is building provider capacity, not only to meet overall demand, but also to better address the needs of our diverse patient population. The Pathways to Practice program, contained in legislation the committee marked up last year, would help build a diverse physician base that receives the necessary training to appropriately care for the diversity of need across our nation. The growing mental health challenges only add to the need for this crucial policy. We also need to strengthen care across the entire mental health continuum, making all types of providers more accessible, not just physicians. Marriage and family therapists and licensed clinical social workers are two examples of non-physician providers that could make a huge impact in people's lives and on their health. We must also better align coverage to meet needs. The Biden administration recently released a report showing that despite longstanding mental health parity requirements, insurance plans inadequately cover all mental health care. Patients deserve better. Accordingly, today we will also discuss how we can strengthen our enforcement measures. The outpouring of interest in today's hearing demonstrates the urgent need for action. This hearing is just the first in a series of the topics which clearly are on the minds of the American family. I'm again pleased that Ranking Member Brady shares my interest and commitment to addressing these matters together. Ultimately, our goal is to take action as soon as possible and begin changing the way that we deliver and access mental health services in this country. We must eliminate the stigma around mental health care and focus on building a system that is holistic, accessible, and equitable. With that,